This is Dr. Ronald Ritchie. Good to see you here with me on this presentation regarding alternative treatment for diabetes. There is a lot of information out there about diabetes, and you've probably seen more and more commercials on television for various pharmaceutical treatments for diabetes. Well, there's a reason for that. That's because diabetes is becoming one of America's singularly severe problems. There are a number of different and very frightening trends in diabetes. First of all, and this is something that used to be considered a problem and it's kind of faded away from the spotlight, but it is still very much alive in America, and that is the fat phobia. This is a little bit of an old statistic, but 1 in 4 college girls believes they are fat. And interestingly enough, if you read some of the information out there, down to as young as 3 years old, both boys and especially girls are being told that they are fat. And there could be no greater error than that, primarily because of the improper and unbalanced self-image it creates. But there's a whole psychological aspect to the fat phobia that goes on. This does have a significant impact on the concept and the trends in diabetes. People eat generally 200 calories per day more than they need in their diets. And 200 calories, that's a statistical average. 200 calories is not that much. A candy bar has nearly 350. And if we look at something like drinks that you get at the local corner store that you're going to guzzle down as you're driving to wherever you're going to, a 12-ounce can has nearly 300 calories. Don't even talk about the designer drinks we have these days. Some of those drinks have as much as 850 calories that you're going to consume in one gigantic meal. And this type of caloric increase, especially since all of those are in refined carbohydrates or just straight out sugar, they create this positive caloric intake that spikes insulin levels and generates weight gain. And here you can see 1 pound of weight gain every 18 days just from 200 calories a day increased consumption. Another thing that is a constant problem in our country is binge eating and compulsive eating disorders. Binge eating is defined simply as overeating 1 or more days per week. 1 or more days per week. So that means if you've been a good girl or a good boy and you haven't eaten badly, and we've got some kind of sports event that's coming up here on Saturday or on Sunday, and we're going to have a pizza and we're going to wash it down with several cans of your favorite beverage, that's the definition of binge eating. That contributes to the genesis of diabetes and cardiovascular disease. Compulsive eating disorders do the same thing. This is where a person compulsively eats the same foods over and over and over again. This is being seen very much more so in children these days who eat nothing more than chicken nuggets and French fries, or only will eat a certain kind of cheese. And people with these compulsive eating disorders, especially in children, it's almost always carbohydrates and refined bolus loads of carbohydrates. This is very bad. This is one of the primary causes that's believed in children to be the increasing trend of diabetes at progressively younger and younger ages. Then we also have societal constructs and the obesogenic influences that are occurring in our society. I have another video on superior nutrition for a super you, in which I discuss the obesogenic society and its origins. This was a great book that was written called The Obesogenic Society several years ago, but the trends seen even over a decade ago are still present today, and their long-term influences and consequences are being noticed. just generally in society, the things that we eat of chips and salsa and queso and various drinks and the candies and the crackers and the snacks are all high carbohydrate foods that will cause an individual to become diabetic. We see that, and this is a very scary statistic, there has been a 60% increase in the presence of diagnosed diabetes in just the past 10 years. Just in the past 10 years. Statistically, they are saying that 1 in every 5 people, that's 20% of the U.S. population, will be diabetic by the year 2020, and that's not far away. Obesity is increased by 65% since 1970. If we go back to 1940, when there's some really solid data, it's increased by 80%. Here's a little interesting statement. In 1990, just 1990, 20% obesity rates existed in only 10 states in the U.S. What that means is 20% of the population of a state was defined as obese in 10 out of the 50 states. In 2008, and that's dated by nearly 10 years, 25% of the population was diagnosed as obese in 45 out of 50 states. That's sad. Obesity and its consequences are one of the worst health dilemmas in the United States today. And this is true no matter who you read. Most authorities believe that obesity is the singular cause for the substantial increase in diabetes in the United States. That's really sad because obesity is a very, very treatable and correctable condition if a person chooses to do so. Well, what are the causes of diabetes? Well, there are basically 3 types, you might say, or 3 general categories in which you can place all diabetics. First is genetic or inherited, and that's type 1 diabetes. They used to call it juvenile diabetes, but it is type 1 diabetes. There is environmental, which can be type 1 or type 2. And then there is instructional or societal diabetes, which is only type 2. That's also called metabolic syndrome, syndrome X, syndrome W, insulin resistance syndrome, and insulin dysregulation syndrome. So it's got various names. So these are the 3 categories: genetic, environmental, and instructional. So let's talk about, first of all, genetic or inherited type 1 diabetes. This is usually very characteristically found in families. You can find it in mother, dad, grandmother, grandmother, grandfather, or in direct first grade family relatives. It occurs mostly in children all the way up to the age of about 18 or 19, and they're most always insulin dependent. So that's genetic type 1 diabetes. Second type are environmental diabetics. That is, can be either type 1 or type 2. And if it's type 1, it's usually because there's been injury, infection, or disease involving the pancreas and damaging to the islet cells that generate and produce the insulin in our body, so that it no longer is able to do it in a proper way, or there's some other injury that's damaged our ability to sense the need for the increased insulin, and they usually become insulin dependent. If it's environmental cause and type 2, it may not necessarily have been tremendous damage to the pancreas and its ability to produce insulin, but is managed more by oral medication rather than the need for insulin to treat the diabetes. The third type is the instructional or societal type of diabetes, and that's always type 2 diabetes. This used to be called adult onset diabetes or non-insulin dependent diabetes mellitus. It's had these names: syndrome X, syndrome W, metabolic syndrome. The most common description I hear these days for this type 2 condition is called insulin resistance syndrome. And that's a really good description, although insulin dysregulation syndrome is also a good description. This is where the body is producing insulin, but it's either producing it at the wrong times or in insufficient quantities to deal with the dietary intake of sugar. Most type 2 diabetics are adults. They're usually later in life, mid and older individuals, and this is primarily from bad habits and bad training as a younger individual. Usually it's managed by oral medications, but interestingly enough, and not too surprising, is dietary changes strongly influence the presence of this condition. I have seen many times where patients will have this problem. We make diet and lifestyle changes, and all of a sudden their diabetes is well under control, and sometimes it will even completely remit to where once they get their weight correct, their activity right, their sleeping right, their fluid intake right, then all of a sudden the diabetes just goes away. That's because it was caused by learned bad habits or poor dietary habits they didn't know were poor habits. Yet it can be changed a great deal. What do we do? What are some of the alternative treatments for diabetes? Well, they come in three categories: dietary changes, activity changes, and nutraceutical interventions. So we're going to explore each one of these three here for just a few minutes. First of all, dietary changes. This is probably the singularly most difficult thing to do, because we eat so much out of habit and not out of need in the United States. Our habits of eating are the biggest problems we face because we have habits that are so easy to generate and so difficult to change. That goes back to that obesogenic society constructs and how we eat, the environments in which we eat, and what we eat are controlled and dominated so much by society and our own environment that we create for ourselves. Well, dietary changes should focus upon the glycemic index and carbohydrate quantity and quality of foods. Now, what I mean by that is that the foods we eat, we should understand that certain foods have a higher glycemic index. That just simply means that that food turns into sugar very, very quickly, placing a stress on our body's ability to handle that big giant load of sugar that just came in, spiking insulin levels and creating stress on our body's sugar control mechanisms. We should understand how much carbohydrate, and not just how much, but the quality, the kind of carbohydrate we are eating. We should focus on complex carbohydrates and not refined stuff. Now that simply means, unfortunately, guys and gals, that sugary sweet foods we should reduce, and complex carbohydrates in the forms of things like pastas and rices and beans, that's what we should be eating, and not all these sugary, sweet, high glycemic index foods that turn right into sugar within literally 20 or 30 minutes of their consumption. We should focus on, and with people with blood sugar control issues, multiple meals a day, small meals the size of your fist, an amount of food that is the dimension of your fist and no larger. I mean, most hamburgers you buy nowadays are bigger than your fist. And under this guideline, that hamburger is all you should eat. Really, honestly, most burgers these days in fast food places really are not that good for you because they contain way too much in the way of refined carbohydrates. That's why they taste so sweet. And we shouldn't be eating that much. So 5 small meals a day prevent the highs and the lows on our blood sugar. It doesn't let our blood sugar get up too high, but it also doesn't let it drop too low. It prevents these spikes in blood sugar that create the problems of diabetes. So we should focus on multiple meals a day. Avoid binges and alcohol. The number one problem, not number one, but a huge problem is binge eating. We're good boys and girls all week long, and then the weekend comes and then the wheels fall off the wagon and we go crazy in eating. That will give you diabetes and heart disease just as fast as eating a candy bar every single day. And then alcohol. That is a huge problem because alcohol is nothing but a sugar waiting to destroy your liver and your pancreas. It is tremendous amounts of sugar intake, and it's damaging to the body in every single aspect. Another thing is proper and adequate fluid intake. Now, fluids, I mean mostly water. We don't drink enough water generally. We drink too much of the wrong kinds of fluids. We should be drinking a lot more water. And the rule that I give my patients, if you want to drink a Coke, okay, but you have to drink 1 glass of water before you drink the Coke. You have to drink 1 full glass of water before you have another cup of coffee. You have to drink 1 full 10 to 12 ounce glass of water before you drink another glass of tea. If you do that, you'll get better fluid intake. Notice I said better, not best, just better. And the last thing is we need to determine our caloric need not based upon what we want to eat, but what we need. And that's a measurement of what's called basal metabolic rate, or BMR. I talk about basal metabolic rate and BMR in that other video called Super Nutrition for a Super You, so I'll refer you to that to get a determination of proper caloric need. That goes back to those first sections I tell you where I said that statistically it shows that we consume 200 calories per day more than we really need. We think we need more food than we really need. It's amazing how much we overeat thinking that we need that many calories because we overestimate our own caloric need. We think we're burning a whole lot more calories than we really are. And the truth is, we could all use a lot less to eat. Some additional alternative treatments that we need to think about are in activity changes. That's the second category, activity changes. Well, despite all of the advertising on television about getting fit and getting active and these interactive apps on phones where we go outside and try to find the little digital creature that we're supposed to capture, well, despite all these things to try to get us up and active and busy outside, guess what? Exercise improvements in health are still decreasing in the United States as a whole. We are still an ever increasingly sedentary population. Regular exercise of moderate exertion of 3 to 5 days per week is what everybody should be doing. We should be doing some form of exercise. 30 minutes of moderate exertion exercise 3 to 5 days a week will make huge changes in your physiology. It will make huge differences in how the Ferrari engine that you were born with works. So do not discount that, and don't think that you can exercise and going out and working and cleaning up your yard on a Saturday and working all day and getting hot and sweaty is good exercise. It's not. That's binge exercising, just like binge eating. It's bad for you. What we should be doing is regular, moderate exercise as far as a lifestyle habit. These are necessary activity changes we all should engage in. Another biggie that is overlooked often is good rest. We need adequate rest, and it's for more than just getting rest so we're not so tired sitting at our desk tomorrow. Adequate rest, inadequate rest, poor sleep levels. Studies have shown that people that do not sleep well have higher insulin levels, and it increases the resistance of insulin in our cells because we're not getting sleep. It actually raises our blood sugar levels and causes insulin as part of the cause for insulin resistance syndrome. Now, good rest, that's a whole nother subject, but good rest is not just the number of hours. It's also the depth of the sleep state. We need a minimum of 7 hours of good sleep, and we need a minimum of 4 of those 7 hours in a deep sleep cycle. If you wake up in the morning and you feel like you should go right back to bed because you're so tired, that means you never really got into good REM sleep. And that means you really didn't rest. And that means there's pretty significant impacts on your blood sugar, on your blood pressure, on your focus and concentration, on your mood or your affect. Those are all significantly impacted. But here specifically related to diabetes, poor sleep increases insulin resistance in the body. It's been studied as a fact. So good sleep is necessary. Let's talk about that third category, nutraceutical interventions. Now, nutraceutical is just a very simple word that means nutrients that are used as therapeutic tools. So, a vitamin C to try to help you ward off a cold, that is a nutraceutical, a nutritional therapeutic use of vitamin C to help your body recover from a cold. So, we're going to talk about nutraceutical interventions specifically as they relate to diabetes. Well, the first category are minerals, and these, chromium, vanadium, magnesium, potassium, zinc, and selenium, are extremely important when it comes to blood sugar maintenance and alternative treatments for diabetes. Now, how much of these, I can't tell you. Not because I don't know, but because everyone is unique. And you may need chromium and not vanadium, or you may need vanadium and not chromium. So, that needs to be determined by a professional who has done diagnostic testing to know exactly which ones you need. And a big warning here. If you go down to your local big box health food store and go and ask the guy, hey man, I've got blood sugar problems, can you get me something to help with that? And you start taking a boatload of chromium or vanadium or selenium, you're going to give yourself cancer. I don't know any other way to put it, but that's just the facts of the way it is. Selenium overdose mimics cancer. Chromium overdose mimics cancer. And not only does it mimic it, if you keep on going with it, it definitely can cause cancer. So this is not something to play with. This is not something that you go down and the guy that's behind the counter at your big box health food store tells you, yeah man, that's some really good stuff to take. You're going to end up hurting yourself in a very real way. People overdose on zinc quite often, and the overdose symptoms of zinc are the same symptoms as peripheral neuropathy, also called diabetic nerve pain, and that's from an overdose of zinc. So, although these minerals are the right ones for alternative treatments in diabetes, they can also be done wrong very easily. They need to be done correctly by a professional who diagnoses the need. This is not done out of guesswork, and it's not done out of anecdotal evidence. Second category are specific vitamins. Vitamin E, vitamin D3, vitamin B2 and vitamin B6, and B vitamins as a complex are extraordinarily important in managing blood sugar because of their impact on how our body just burns sugar on a basic cellular level. These have to be done right. They have to be done in a balanced way, and you can overdose on vitamin E and vitamin D because they are fat-soluble vitamins. So again, a word of warning, they are necessary, but they must be done in the right quantities with the right types in the right way. And then a third category are oils or fatty acids. These are especially two EPA-DHA or eicosapentaenoic acid and dexahexaenoic acid. These are two fish oils, and fish is the primary source in which they're found. If you find a place that says, oh yeah, there's omega-3 and omega-6 fatty acids in these grain oils, well, there are omega-3s and omega-6s in there, but they aren't EPA and DHA. There's a whole biochemistry lesson that we'd have to go in here to explain the differences, but in treatment for diabetes, EPA and DHA are tremendously important for two reasons. First of all, they help reduce inflammatory changes within cells and prevent the cellular inflammation process that occurs through the arachidonic acid cascade. And secondly, they stimulate and support the repair and function of nerves in the body. And they must be consumed in the proper quantity. EPA and DHA can be acquired through diet, but that means you have to eat a lot of fatty fish, and that is salmon and tuna in the U.S. And most people don't eat enough of that to really get an adequate level, primarily because in people with dysglycemias or blood sugar control diabetes problems, their demand for these oils as well as these minerals and vitamins too is about 2 or 3 times higher than a non-diabetic person. Well, the fourth category are called botanicals, and that's your herbs. Boswellia, cinnamon, garcinia, gymnema are 4 of the major ones. There are a couple of other ones, but these act like the oral medications used to manage diabetes. Some of these actually affect insulin receptors in cells and turn on and activate insulin receptors to trigger insulin's function and help correct insulin resistance. Now, which ones in the quantities necessary, that must be diagnosed properly. And interestingly enough, most of these botanicals, to get them in the proper quantities and the proper types, so it's not just how many milligrams, it's how many milligrams of the essential bioflavonoid that have been carefully measured in that particular herb, and then make sure that they are handled correctly, and there it's the proper type. This must be diagnosed correctly in order for it to be done properly. And so a professional who is well familiar with these botanicals is the ones you have to go to in order to get the proper amounts, and done so based upon proper diagnosis. Now, I just said a whole lot in this alternative treatments, especially in the nutraceutical interventions, but this is very, very key in a way that you can manage diabetes in an alternative fashion. What's the conclusion to all of this? Very simply put, diabetes and blood sugar dysglycemia control issues is not a simple problem. They are complex because people are complex. They are unique because each and every person is unique. Everyone with diabetes has to be handled differently than every other patient with diabetes, just like a person with blood pressure problems has to be handled differently than every other person with blood pressure problems, because we are all unique. But diabetes is not a simple problem. They are conditions that people live with and require a well-diagnosed, holistic treatment program. This is not something that you can use anecdotal evidence or something you read on the internet that says, this is how I can handle my diabetes. That's not a good way to do things. You need to have a professional sit down face-to-face with you, do the appropriate diagnosis, and really design a program that's best for you to control that blood sugar issue. Well, another video on a condition that is a significant problem in the U.S. Well, this is Dr. Ronald Ritchie, and my hope and my wish for all of you is to improve your health through good education, good awareness, and proper diagnosis of conditions and treatment that is designed to really be target specific for you. I hope this has been helpful. Take care. Goodbye.